Back with another video. This one is not going to be music production related, so if you normally tune in for the music production content, this one is not going to be related to anything as far as making beats. If you've been following my journey for the past 6 months or so, you know that in February of this year, and I did a video like after the first week, and I did another one after like the first 30 days. This is going to be the 6-month video from my post-hernia surgery. And as far as the progress, there's been some good, there's been some bad. Let's talk about the good first. So I have been able to work out since about a month after I had hernia surgery. And it all started out mainly with just doing a lot of cardio that consisted of elliptical, also some jogging on the treadmill, and maybe a little bit of jogging outside. I can't really run like full speed just yet. Outside of that, I increased like the amount of weight that I would lift. I still, I'm not lifting anything really over 100 pounds, but just enough to get a burn, stay in shape, and been working on, again, a lot on my cardio over those last 6 months or so. And over that time, as I said in the past video, I feel pretty good for the most part. There's no pain. The only thing which kind of leads me to the bad is I talked about after the 3-month video, in fact, that there was still some swelling in the groin area. Well, upon getting that checked out, we looked a little bit further, and I actually had a checkup which was in mid-June, and the doctor then made me go to a place out here in Dallas, and they did like the scan on the area, kind of the groin area, and expands a little bit. It's more of it feels like there's something in the groin area that is pulling me down, kind of like there's just some pressure right there. And once they did the scan, they ended up finding out that it was a hematoma, and what happened is there were some blood vessels internally, I guess, that were injured in the process, because I had a rather big hernia, and it caused some bleeding internally. So what happened is it stayed, as far as like the groin area, it stayed with some swelling in that area. And basically I have another appointment in about 2 weeks or so, and they're gonna pretty much at that time determine that surgery will be the best route to go. Again, to clear that up does come with some risk as well, and in terms of like infection. So we'll see about that. It's kind of like, from the way that was described, I had the laparoscopic surgery, which means they make 3 incisions on your stomach, one on the left, one on the right, and one kind of above the belly button area. The camera goes in the belly button area, and these little kind of like in robot like hands actually go in the left and the right, and that's kind of how they fix the hernia from the inside. That's one way they do it, but they also have another process which is called the open procedure, and that's more where they cut you on the outside, and they have to go in from the outside. So I say that only to say that based off of what my doctor told me the surgery is going to be like, it sounds very similar to that. And I knew a few people that had that process done, and it does take a little longer to heal compared to the laparoscopic way of doing a hernia. So I know they're kind of not the same as far as the type of surgery that I'm going to have, but I only say that it's going to be an incision kind of in the same area. It's just going to be a little bit different surgery. And I've done a little bit of research. I guess we're going to talk more about that when I go in, as far as the process for the surgery, I guess you could say. Some say it's more of draining, and then some say it's more of kind of pulling out scar tissue and other there's blood and scar tissue in that area that they have to kind of pull out, so that's also another part of the process. So we'll see what the doctor tells me. We talked briefly when he called me about the scan, and he said it might be a week as far as the recovery time. I'm a little skeptical of that, just given what I read. And like the last time I prepared for this hernia surgery, I did a lot of research as well, and I saw a lot of people's experiences from also people that were telling their story here on YouTube, and everybody was a little bit different. I'm just a little skeptical. I don't know if this is going to be a week. Last time I was pretty much down for about a month. I don't think it may be a month, if it's not as in-depth of a injury and a surgery as the hernia surgery was. If this is something that is more so, just draining the fluid and the scar tissue from the groin region, then, maybe I won't be down that long. But I'm just kind of preparing as if I'm going to be down for a month again, because the last time it probably took about, I would say, for the first 2 weeks, I couldn't really walk, freely. I remember like my nephew had a basketball banquet that he asked me to walk with him out to half court as a part of the pre-game festivities, and I remember it was just a struggle for me to even walk out there on the basketball court with him. And I couldn't at that time. It was just a lot of stiffness and a lot of soreness, and it wasn't until probably about the third week where I was even able to walk around my apartment complex. And I started off like that, and I did that for like a week. And as the pain became less and less each day, I kind of picked it up even more until I was walking like a mile, then 2 miles. And once I got to that point, that's when I really got back into lifting and being able to jog, and I even do the Stairmaster a lot. I just found other ways to work out, being that I can't really lift heavy at this point. Speaking of, they told me as well, having this surgery, I won't be able to lift anything for, I think, like 4 weeks or so once again. And I'm just gonna kind of go back to doing the same things, walking around and trying to do elliptical and the Stairmaster a little bit lighter, at a lower speed. So I'm gonna find some ways, but hopefully this is the last time that I have to deal with any type of surgery for the foreseeable future. This year was just kind of tough in that regard. Going in with the hernia surgery, I haven't truly been healthy for a while, and this is a little bit different because with the swelling, I can't necessarily run full speed. Sleeping certain ways is a task, and even like just working out, it's kind of been a seeing what works, seeing what doesn't work type of thing, just over the last 6 months, to see what feels comfortable as far as being able to work out. And it's gonna get better, but it does take a lot out of you after a while, when you're just trying to do normal things, and it's a little bit tough to get a customer pulling back. You know, I said in the previous videos that up until the hernia surgery, 41 years, and I had probably one surgery, and that was my tonsils getting taken out when I was like 10 years old. I remember that day. If you haven't seen my first video, I'll leave that in the bio for you to check out. But it was just the day of surgery was so like, I felt like I was just on all types of stuff, the pain blocker, and that was pretty active for like 3 days. I felt kind of like, you know, I was high, didn't even need to smoke, and that's a feeling that, you know, just kind of thinking that's pretty much what's gonna be ahead, and you know, we'll bounce back. And to everybody that is a part of the music producer community, and some of you aren't, but some of you are still supporters. Some of you came across me by just watching those videos because you were also going through the hernia surgery process. I appreciate your time for watching these videos over my journey, and if they could help somebody along the way, that's one of the reasons that I do it, because at the time when I was doing a lot of my research online, I was finding a lot of older videos from years past, and I wanted to make something that was a little bit more recent, and just giving a different perspective with that. So yeah, that's all I've tried to do. And you know, two, I always kept it 100 with the people that support me and what I do on this channel, and just wanting to let everybody know that the content's gonna slow down for just a little bit, probably in September, but just like last time, I had a lot of content ready to go, and I still had like podcast episodes, beat making videos, and then instrumentals still went up, even though I didn't want to get on camera for probably like that first week or two. It was hard to get around, so I still arranged some beats from my Mac and from my iPad and uploaded those to the website. And then probably like the third or fourth week, I got back to doing beat making videos so I can get around a little bit better. So it may be the same way. I don't know again how long I'm gonna be down. So, you know, just stay connected with me for that. Follow me on Instagram at d._majormusic, the same thing on Threads, and on X at d.mme. And go ahead, hit the subscribe button. Until next time, hopefully there's some better news, and just say a prayer. We're gonna get through this, and the show not gonna stop. You know, it's only gonna be paused for just a moment, and I'm gonna be back.